It's a real pleasure to be able to talk to you about your career in the NHS. I understand that right now you're a chairman of a large trust in the east of England, and I wondered whether you would be able to talk us through what you do and what took you there, really, how you got to that place.
Yeah, thanks, Linda. Gosh, it's been an interesting journey. So, to my horror, when I add it up, I'm in my 45th year of working in the NHS. So the NHS can certainly give you long and interesting careers. And I started as a student nurse, became a nurse a bit by accident. But I'm now the chair of East Suffolk and North Essex NHS Foundation Trust, which is a very large integrated trust. So we run Colchester and Ipswich hospitals, community health services. It's about a billion turnover, 12,000 or so
Mhm.
staff. So from the starting point to there has been not something that I could have foreseen, but it's been a really interesting journey.
I think that's really important because many of the people that I work with who are starting off on the first steps in their career, they they have the view that you kind of plan it and it works, step by step, you work your way through.
Mm.
But actually, I think for those of us, as you say, who've been around for a little while, what we understand is that things happen in life and you either take opportunities or not. And it would be really interesting, I think, for people to understand how you made that journey from student nurse through to chairman of a great big trust in the east of England.
Yeah, sure. Um, well, when I say I became a nurse a bit by accident, it wasn't something I'd always wanted to do. I was academically pretty able and was doing my A levels and doing science A levels. Didn't really know what I wanted to do. But I was also a teenager rebelling against kind of fairly strict parents and decided that was it. I wanted to leave home and I could become a nurse and I could live in the nurse's home. And that was suddenly the thing I was going to do. And so I applied, having really not thought very much about what being a nurse involved, but was accepted and started to do that. And I think realised quite quickly, and ironically, where I've ended up, that at that point, sort of hospitals weren't where it was at for me, but I was going to stick to it and complete my training. But about a year or so in to my nurse training, I met and went out with a really inspiring woman who was a health visitor working in quite a challenging area in the community. And I decided at that point that that was the path for me in terms of working in communities, health visiting, and that I would work towards that. So I was just 21 when I qualified as a nurse. I then went and did midwifery for 3 years, and then went to university to do the health visiting course. So that bit was probably the most planned part of my career, even if I became sort of fell into nursing a bit by accident. So by the end of my 30s, so after about 5 years as a health visitor working in a couple of different areas, I was also completing my first degree because along the way I'd realised that the person I'd shortchanged was me, not anybody else, by not going to university at 18. But I also was studying for a degree in social policy, which wouldn't have been what I'd done at 18. So actually found the thing that really fired me up and I wanted to study when I went to university to do the health visiting course, and then followed that up. I was working full time and studying as well. So I was coming to the end of my degree, 5 years or so on from being a health visitor, and really started to feel I wanted to do something different, but didn't know what. And we moved at that point with my then husband's job to another area. And just by chance, I saw an advert in the Wednesday Guardian, used to be where the sort of health and sort of social policy jobs were advertised. Saw a job that was a joint strategic job between the NHS and local government. Now, I'd never done anything like that, but decided to apply, and to my surprise, got that role. Colleagues in the NHS thought I was mad because I was going over to work in local government at a time when this was 1990, so partnership working wasn't kind of what it is nowadays. But I really found my niche at that point. I was working with a really sparky, bright team of people at a time of quite a lot of policy change. And although I felt kind of quite in awe of them, and I was the sort of junior one in, I really loved working in that team. And the two people who saw some potential in me, even though I hadn't done anything like that in the past, became great sort of mentors and supporters. And to this day would be the two people I would sort of really instrumental in that change. And so that took me on a different path. And after 2 or 3 years doing that, 3 years, I think, I felt I needed some management experience. I hadn't ever managed or led a team. And again, one of those people then gave me an opportunity to lead a really big service, which was quite a scary jump at that time. But then over successive years, I moved backwards and forwards between the NHS, local government, just when I saw things that looked interesting, and I thought, oh, I'll go for that. And so I think when I was reflecting back, I think perhaps I was relatively unusual in that sense that I moved geographically, I moved between different sectors, and I think there's research that men, I think, look at job opportunities often and look at what they could do, and women perhaps more traditionally look at where their gaps are in their CVs and things, and perhaps I don't know why, but I was looking more about, oh, I think that looks interesting and I could do that. And so in my 30s, I had a lot of job moves, a couple of mistakes along the way, but a lot of job moves moving around. And so from being a frontline clinician at 29, by the time I was 38, 39, 38, I was appointed as head of adult social services in a newly created council. So for me, there's definitely learning about there wasn't that obvious path. I never was the job I wanted is my boss's job and then their job, sort of in that. I moved sort of vertically into different sectors, and just built something. And there's always an element of luck in it as well. And I think partnership working became increasingly important over that period as well. So by the time I got my first board level role at 40, then it was a joint role at the board level in the NHS and in local government, and a newly created role at that time that my fairly unusual path had actually equipped me really, really well for. So there was no great plan. And then again, I took a national role for a period working for the Audit Commission, which was really interesting. Not for me longer term to be a regulator, but I learned a lot in the period that I was there. And then I'd always worked in shire counties, fairly leafy areas. And through my work at the Audit Commission, came into contact with some people from Tower Hamlets in East London, so very different. And I thought that was a gap. I hadn't worked somewhere like that. I'd never worked in London. And so got a role as head of adult services there. And then I started to get into a bit of an annual cycle almost, where my appraisal conversations, my director would say, your next step, Helen, you should be a director. And I'd be saying, I don't want to be. I really like being the kind of second in command and having this kind of relationship. And then one day he said to me, well, I've got another job and I'm going, and I want you to act up and see whether you want to do this or not, rather than just say you don't. And so I became acting director, and then actually quite quickly decided I quite enjoyed this, and actually was quite good at it as well. So I think, you know, I held myself back in some ways. I can see that. I can see that now. So what else happened? By my mid-50s, I mean, you'll gather from this, I've moved around a lot, and I think for me that was partly about boredom thresholds, and partly about developing my career and building on things and taking those opportunities. By my mid-50s, I had an opportunity to take early retirement. So I describe myself as a sort of happy victim of austerity, in that a number of posts were being deleted in the council that I was working in at that point. But I was ready, after a number of years of austerity and doing lots of difficult service cuts, to move on to a different phase. And so for me, the last 7 years have been more of a portfolio phase, doing a mixture of non-exec work, some consultancy, some interim work. But again, I didn't see myself as a chair. I was very happy being a non-executive director, doing about a day a week in a trust, and then again, the chair moved on to another role. I was asked to do it on an acting basis, and then decided that actually, again, I quite liked this, and so I applied and was appointed through a national process, but to the substantive role. So I've been chair now at the trust for about 3.5 years, and we were formed as a trust as a merger between two smaller trusts, about a year or so before I became chair. So it's been a really interesting journey about bringing the two former organisations together, bringing in community services, starting to work in much more of a system way, which really plays to the experience that I've had around partnership and collaboration. So
you've certainly had quite an interesting journey, haven't you?
yeah, it has been. Yeah. And some mistakes along the way, learning there about, if it's a mistake, then, you know, draw a line under it quickly and move on. But there's always learning. I think I learned that from you, Linda, that you know, there's no failure, only feedback. And so, yeah, on a couple of occasions, jobs didn't turn out to be what I thought they would be, or perhaps things changed in the environment that I couldn't control. And then in those circumstances, I decided I was going to move on, really learn from it, but move on.
And I think that's really quite powerful for a lot of people. You don't have to get stuck somewhere, do you? You can learn from it and move on. In terms of the interesting pathway that you've taken, when have been some defining moments? Could you kind of identify one or two and share those with us, and what caused them to be defining?
Yeah, I guess probably one of the most important and defining was that point that when I moved out of a clinical role in the NHS into this strategic partnership role between local government and the NHS, because it was moving into a completely different role, into a different sector. And I think the fact that two people saw potential in me was really very important, and that the feedback and the support that I had from them was massively important. I learned different things from, they were two very different individuals. One was very strategic, very clear, and that sort of taking that longer term perspective on things was very much where Roger was. So that start with the sort of the end in mind, and then align what you're doing towards that. With the other person, Hilary, she's a real people person, and a very different character to me, but she took me under her wing. I became one of her people, if you like. She mentored, supported, gave me opportunities. And I think, again, I've tried to do that for people, but she really she would go out and meet staff, and maybe she'd not seen somebody for a year or something. She'd remember a lot about them. It didn't matter whether somebody was a porter or a director or a chief executive. She was very, and is to this day, very sort of people oriented. And for me, again, there was sort of learning about that. No matter what you do, what position you have, it's the people at the end who deliver, and the team around you. So Hilary would never describe herself as a big strategic thinker, but she got good people around her for, you know, what she knew she could do really well. And I think that's been important learning for me as well.
Because you've mentioned throughout this conversations, people have helped you by reflecting things back to you or giving you a step up the ladder. How has that helped you help people in your career?
I suppose I can think of some specific instances where, I mean, there've been occasions where I've formally acted as a mentor or a coach for people. I can think of one particular circumstance where I'd taken on a new role, a director of social services role, and was told by my boss, the chief executive, that one of the people who was working to me was really kind of not up to much, and probably didn't have a future. And my take on that person was that actually they had a lot of potential, and I liked them, and it was working well with them. So I, you know, took a stance that was very much, this is what they're doing, and I think they have got potential, and I'm going to keep that person. But actually, she has gone on to fabulous things, and it's been really lovely to see that. So I think that giving other people the support and hand up, being confident in your own views about somebody, not taking necessarily what other people had said. So that sort of coaching, mentorship, all of those things have been important to me, and are still important. As a new chair, 3.5 years ago, I linked in with a very experienced chair who's mentored me. I still use coaching kind of periodically. So I think you never stop, but also I do try to give back in the same way that people gave me opportunities.
I think that's really important for people to hear, that you don't have to stop learning. There are always things to learn along the way, no matter how senior you are or how experienced you are. So what would you say has been your biggest learning, and how's it helped you?
Gosh, I think there's something about always being self-aware and seeking feedback in a number of ways. So understand yourself, really, because I think it is really important to be authentic. So understand what you're good at, understand what you're not so good at, or what maybe aren't your natural default positions, and then work with that. So I mean, I can remember, again, very clearly, the first time I ever had psychometric testing done and thinking, oh, this is a load of nonsense, really. And then getting a readout and thinking, oh, my goodness, this is me, but really, really important. So it might be 360 feedback, it might be psychometrics, it might be all sorts of ways of getting feedback. But I think understanding yourself and then playing to your strengths, but working on those other areas is important to be authentic. So an example would be, I know I can be impatient. I'm sort of quite optimistic and action oriented. I want to get on and do things. And the people I find really difficult are often the people who are saying, oh, but, and are more pessimistic or down in the detail. And I'm not worried about that. I'm thinking about this is where we're going. But what I've learned, painfully at times, but it's really important to listen to those people, because sometimes, although if it's expressed in a very negative way, that can be difficult. Sometimes in the middle of all of that, there's some really important things that actually will make what you're trying to do more successful, because you take those into account and mitigate against it. So, but I know I've had to work with that. So not just that sort of impatient or dismissive response, but yeah, listen to people. Also know, that sometimes there are times when you have to say, I've heard this, and now we're sort of moving on. Don't get dragged down, but there's stuff there, so from different styles. So I think being aware of something like that has made me a better leader, because it's changed my behavior. So I think authenticity and being self-aware is really important.
So authenticity comes up quite a lot in leadership programs that we run, and people seem to, they have the concept that can be quite difficult at times. What would you say to that?
Gosh, is it difficult? I suppose perhaps it can be there. I mean, we all have situations where we don't feel confident or on top of things, and I think, sometimes, you can say, this is something I'm not familiar with or whatever. So, but I think, those things in those situations, being really authentic can be difficult. In some situations, you do need to do that, fake it till you make it, really, and present a confident persona, even if inside you're sort of thinking, I really don't know about this, or I'm not sure, I've not experienced this before. So but I suppose for me, authenticity is about how you do things. It's about being true to your values, and those things shouldn't be difficult, as if you're clear about what they are. But I think, we are all of us in difficult situations from time to time that will test us.
Yes, absolutely. And so you've obviously had a very busy life and done lots of different things. How do you maintain some balance in your life?
Yeah, I think balance is really important. And I remember thinking about it a lot, particularly at that stage when I'd just been appointed to my first board positions, because actually what was going on in my personal life at that time was I just got divorced or separated after a long marriage and moved to a new part of the country that I didn't know anybody. And I can remember quite consciously thinking, you're not going to create a new life for yourself if you're at work all the time. And I had been working crazy hours, and I had been starting new jobs every 18 months, couple of years, and then those things have a consequence. So I do remember thinking very consciously about it at that point, and thinking, well, for me, the deal is you work really hard at work, but actually there is no merit in sort of, being in the office till 8 or 9 o'clock. It's so different now with home working and things, but at that point, and that actually I need to be, just as I'm conscious and planned about work things, then actually at times really being conscious and planned about personal things is important as well. So when for example, when I was approaching my early retirement and moving into this next phase, although we had lived in Suffolk for a long time, I'd never actually worked locally, so didn't have those networks, and so set about, well, how am I going to meet people and do sort of some of those things? And so I do a range of things, but friends, family are important. Travel, now we can travel again. Travel has been really important, having regular breaks. So even if you've got a really intensive period, that in a couple of months' time or something, you've got some downtime planned. So I think those things have helped. But balance, yeah, really important.
Yeah, absolutely. And what would you like to be remembered for doing, for achieving?
Gosh, I'd want to be remembered as somebody who was a calm and clear and supportive leader, and somebody who made a difference. So in the roles that I've done, that I had a positive impact in them. So we've just had an external review of our leadership and governance in the trust, which was actually really good feedback about where we are as a merged organisation, and I can see where I've made a difference to that. So I think it's about making a difference, probably is being the running theme. Yeah.
I think that's what draws a lot of us into health and social care in many ways, isn't it? So just as we wind up, what would be a key piece of advice you might give to somebody who is considering starting out on an NHS career?
I think the NHS, or kind of broader, the sort of health and care sector, can give you a fascinating career or careers. You might have several different opportunities within that. It will be demanding and challenging, but really rewarding as well. And grab those opportunities, really. So I think I spent some time recently with apprentices. We have over 300 apprentices in the trust. And an apprenticeship is so different these days. So many of them, they weren't 17-year-old school leavers. They were people, there's an apprenticeship route into nursing or doing therapy work or finance or a whole range of different careers. So I think, the NHS for me is really good in terms of developing people, or for me certainly has been good in terms of developing people, supporting people into that. And so it's a large employer, and can give you a really good and interesting and valuable career.
Brilliant. Well, thank you so much. I'm sure there's a lot of food for thought for people in our conversation today. So thank you very much, and good to talk to you.
Yeah, thanks, Linda.